Hello, I am Lisa Obradovic and would like to welcome you to Certification Inspiration, produced by the Wound, Ostomy, and Continence Nursing Certification Board, otherwise known as WOCNCB. Founded in 1978, WOCNCB is a not-for-profit professional international nursing organization certifying over 9,000 registered nurses who are specialists in the field of wound, ostomy, continence, and foot care. In this episode, you will hear a conversation with Jill Trelease, Clay Collins, and Jonathan Smith, all certified foot care nurses. They will be discussing the value the specialty brings to their practice and their patients and where the specialty is headed in the future.
Hi, my name is Jill Trelease and I am a nurse practitioner. My specialties are wound, ostomy, and foot care, and I'm certified by the Wound, Ostomy, Continence Nursing Certification Board. And today we are going to talk a little bit about foot care. Just to give you some of my background, I currently work in an outpatient wound center and I manage the inpatient wound and ostomy consults. I live in Rhode Island and I work in Massachusetts. And I'm going to introduce you, actually he's going to self-introduce, to my favorite Texan, Clay.
Thank you. My name is Clay Collins and I am, as Jill said, from Texas. I come from a town called Wichita Falls, a couple hours north of Dallas. I currently work in two different places. I work in an acute care hospital where I do inpatient and outpatient wound and ostomy care. And then I also work in a psychiatric facility where I do general medical care, and I have a foot clinic as well. So the psychiatric facility where I work is actually the largest psychiatric facility in the state of Texas, and we have 3 campuses. And so we have plenty of opportunity to do foot and nail care as well as other lower extremity wounds. And then John, so we're here with us today. You can introduce yourself.
Well, I'm Jonathan Smith. I'm a registered nurse case manager. I work for the Indian Health Service in Anchorage, Alaska. I'm a certified foot care nurse. I developed a foot care program for the primary care clinics at the Native Hospital in Alaska, training CMAs to do low acuity foot care, nail care for patients in primary care. We've also started a foot clinic at the homeless shelter in Anchorage.
Well, that sounds awesome. I think one of the things that I really want to know about, though, is what motivated you guys to become foot care nurses? How about we start with you, Clay?
Well, I have been a certified foot care nurse since 2007. And what actually motivated me was that I found I was in home care at the time and had been in home care for many years. And if any of you out there, maybe before you specialized or if you haven't specialized yet, you realize that most nurses don't like to do foot care. And so it was one of the areas that I gained interest in really by default because no one else wanted to do it and I saw the need and I was already doing foot care. I was the go-to guy, and then when the certification came about, I became certified rather quickly after the certification first came out.
And how about you, John?
I got certified, I believe it was in 2010, and kind of for the same reasons as Clay, but our physicians were doing all the foot care in the primary care clinic, and they were looking for ways to open up their schedules, and so I got certified in foot care and I started doing the diabetic foot exams, but then developed a certification program for just the medical assistants so they could do the very basic nail care and get those patients up the provider schedule.
So I sort of got a little bit of a different start. I've been certified, I think, since 2010. And it was because at the time I worked in an acute care facility. We didn't have a lot of podiatrists who would come and do nail care on the inpatient side. So the CNO asked me if I would go and get my certification so that when we had the need, I would be able to fill it. And that's how I started. I think we've all had different reasons for getting into it. It's a really amazing field, and I don't know about the two of you, but I'm always astounded when I hear about other people talking about their independent practice and all the ways that they use foot care. I mean, you are both doing some extraordinary things, serving populations that are at need. I use it now in my wound clinic, but I'm constantly surprised when I hear of people who set up practices where they go, they do house calls, or they set up clinics at nursing homes. So if you had to think about the future of where foot care is, where do you think? Do you think it's going to grow more? Do you see it being more in the community? What do you think?
I actually have seen it grown over the past decade or so, and I think, originally the thought was, when this came about as a specialty profession, is that it would be more of an inpatient, long-term care type of thing. And as we've seen it grow and grow, it's moved more out to the community. And I think we're going to continue to see that trend continue because of the growing need. And one of the things that we used to do when I was in home care was, we went to assisted living facilities and we did foot care clinics. And I know other colleagues of mine around the country that do foot care clinics at homeless shelters, other places of need. That's one of the reasons that when I went to the psychiatric facility, that's a large inpatient psychiatric facility, one of the first things I saw that was a missing need was basic foot care for these people. A lot of the mentally ill had come in straight off of the streets and had been living homeless for many years. A lot of them, even if they were in a group facility or some other type of facility where they were being cared for, just weren't getting any podiatric or foot care services at all. And it really does make a difference in their quality of life. And as we all know, anybody that suffers from any kind of mental illness, one of the first signs of that is your hygiene starts to deteriorate and you start to take care of yourself less and less. And you definitely see that, and it makes my day every day when these people come into my clinic and I do something just as basic as trimming their nails, buffing calluses, and how it puts a smile on their face to know that somebody actually helped them, because no one's ever offered anything like that before.
That's great. That's a wonderful thing. And that's definitely something I think as nursing that we're compelled to help. How about you, Jonathan? Do you see, or do you have ideas about what you think the future of foot care will be?
Well, I think just in general, we're an aging population, and as the population ages and kind of lose our ability to do our activities of daily living, I think one of the first things to go is taking care of our feet. And you see that with the homeless population. It's just, they're so thankful when we come in and just, like Clay said, just trim their nails and buff the calluses, and they feel so much better. And it's a wonderful service.
So I would say, based on some of the conversations that we've had, that foot care is not going away. Feet are here to stay, folks. And this is a fantastic certification because it allows you to serve pretty much everyone. And we've heard the term limb salvage before, because we know that once we start amputating toes, it goes further up the limb. People lose their ability to ambulate and they lose their quality of life. So basic foot care can ensure that people have quality of life, and all their parts can mostly stay attached. One of the things that we were joking around about before was some of the long terms that we use in our field, meaning literally the long medical terms. So Clay and I had mentioned a couple. Anecogryphosis. Did you have a favorite long term that you want to throw out?
I think especially for those that take the certification exam, that's one of the trickiest parts of the exam, is all of the onoco terms, and onocogryphosis is a great one, and you'll hear the layman's terms mixed into the exam as well. So the layman's term for that, and who knows where it came from, is ram's horns nails. And if you've ever seen these patients that have ram's horn nails, you understand why it's called that, but I can't imagine where that term actually came from. It's not a really respectable term to go in and say
You academics
you
don't
have
want to take
transform nails,
it.
but
What do we call that nail?
onychogryphosis, onychomycosis. Another one, this one has always been one of my favorites, onychomedesis. Because for some reason I always think of Medusa, but when I use that word, but onychomedesis is another one that it just always brought a chuckle to me. I don't know why that is.
John, do you have any favorite long terms?
I've just always liked onychomycosis too. I mean,
It's just they're big words. They make us sound very incredibly important. Well, we hope you enjoyed this short conversation with us. Most of all, we hope that if you have questions about the foot care certification, you will contact us and hopefully you'll pursue it. So thank you very much and have a wonderful day.
Thank you for listening. WOCNCB sets the standard for wound, ostomy, continence, and foot care nursing certification by validating nurses' knowledge to provide safe, patient-centered care. Until next time, visit WOCNCB.org to learn more or contact WOCNCB at info@WOCNCB.org. And remember to follow us on social media. This podcast is produced by WOCNCB. Take care.